we can prevent a stroke, recommending anticoagulation to these patients. So this is very important because a stroke is responsible of a lot of problems, as you well know. Other different ECG. This kind of ECG corresponds to sinus arrhythmia. Look at the tracing, it's irregular. But this is good because that means a balance between parasympathetic and sympathetic nervous system. If we observe our pulse, breathing normally, we could observe some acceleration. So this is good. On the contrary, patients with poor heart function are going to lose this capacity. So the heart rate is going to be increased. And when this happens at rest, at even during night, this is not good. For sure that these patients, and more in combination with poor left ventricular ejection fraction, is an important predictor of cardiovascular events. In addition, what happens with impedance? If we are able to detect impedance, we can observe the changes of impedance in the chest. So that means that the fluid are being accumulated into the lungs, probably because the heart is not able to impulse the blood. So in this way, we will be able to detect the heart failure before the patient needs to go to the emergency department, to go to the hospital, and perhaps we can treat earlier and save, in this case, not only hospital admittances, but also problems of the patient. So, wearable, implantable, and wearable. We would like to have a lot of signals coming from, for example, these hertz. And we need that in order to diagnose and in order to treat patients. And with this information, we will be able to determine which variable or combination of variables correlate and could predict not only heart failure decompensation, but also cardiovascular death. And we will be able to know which are the threshold values or changes in the variables that can predict cardiac events. Because if we will be able to have information of a lot of patients, we will be able to recognize what happened just before, for example, sudden death. And this has been proven already, and we have some interesting publications talking about that. So it works. My conclusions are that it's clear that cardiovascular disease is getting epidemic proportions, and that current predictors of cardiovascular event are not reliable enough. They have a very, very low positive predicted value, even low negative predicted value too. So implantable and wearable systems will help us to obtain seminal information in order to prevent heart failure and, of course, cardiovascular death. Thank you very much for your attention.
Thank you.